the vignette for Dwight. We will go over the diagnosis, etiological factors, a treatment plan, and a conclusion. This is the vignette. You can pause to read, or it is vignette 1 in the discussion post. We have diagnosed Dwight with alcohol use disorder. The reasons we have done so are because those with alcohol use disorder have a problematic pattern of alcohol use that creates impairment or distress. Dwight has reported being more emotionally reactive to stressors, feeling angry, as well as feeling foggy. He has also stated that he drank about 4 to 5 times weekly in high school and has since moved on to a six-pack of beer daily and even more on the weekends. He states, quote, "It isn't like I am taking 6 shots every day," but his drinking patterns fall under heavy drinking, where an individual consumes alcohol 5 or more days in a month. We cannot say it falls under binge drinking because we don't know if he's consuming that in a 2-hour period, but it is a heavy drinking pattern. His wife is worried and says he is withdrawing from her and the family. While he states he has no problems at work, this is a progressive condition and more issues could arise in the future. Impairment can also include behaviors such as consuming large amounts of alcohol, persistent desire, and failed attempts to reduce how much alcohol they consume, intolerance, and withdrawal. Dwight self-reported no withdrawal symptoms after the few times he tried to stop cold turkey due to his wife's concerns. However, he would experience periods of sadness that would come on abruptly after quitting. He and his wife both denied sadness or depressive symptoms any other time during the past 5 years. He has also returned to drinking all of the times he attempted to quit. At increasing doses, alcohol can cause sleep disturbances, depressed mood, confusion, and sexual dysfunction. On top of feeling foggy and more irritable, he is also waking up several times during the night and unable to fall back asleep and has no interest in being intimate with his wife. The long-term effects of alcohol use disorder, one of the most common conditions with long-term alcohol abuse is low-grade hypertension. Dwight has slightly elevated blood pressure. Despite the hypertension, Dwight's heart rate was in normal range. He also did not experience hallucinations or delusions. He makes eye contact and is cooperative. During a drug screen, alcohol was found, but no other substances.
Mila, and I'll talk about the theological factors. In her book, Abnormal Psychology, Susan Olen Hoxema explains that substance use disorders usually develop through a complex interaction of biological, psychological, and social factors. Using this biopsychosocial perspective, we can better understand Dwight's alcohol's use. First, looking at the biological factors, alcohol affects several brain systems involved in reward and mood. When a person drinks alcohol, it activates the brain's reward pathway, particularly the connection between the ventral tegmental area, the nucleus accumbens, and the frontal cortex. This process increases dopamine, which produces feelings of pleasure and reinforces continued drinking. In Dwight's case, this reinforcement may help explain why his alcohol use increased over time, progressing from about 4 or 5 beers several times a week to drinking a six-pack daily. Alcohol also influences other neurotransmitters. It increases GABA, which produces relaxation, and reduces glutamate, which slows brain activity and can impair thinking and concentration. In addition, alcohol affects serotonin systems that are involved in mood regulation. This may relate to Dwight's report of feeling more irritable and sometimes feeling down. With repeated alcohol use, people can also develop tolerance and cravings, and they may become more sensitive to alcohol-related cues. Dwight's comment that it's not like I take 6 shots every day, it may reflect some minimization of his drinking. It is also common in individuals experiencing alcohol problems. Although Dwight denies a family history of psychiatric problems, a genetic vulnerability can still play a role in the development of substance use disorders. Next, considering the psychological factors, alcohol may serve as a coping strategy for stress or negative emotions. Dwight reports feeling irritable, tired and worried about the future of his business. These emotional difficulties may increase the likelihood of using alcohol to temporarily reduce distress. Well, he also reports difficulty sleeping, and alcohol is sometimes used as a way to relax or fall asleep, even though it can actually worsen sleep quality over time. Finally, social factors. Social factors may contribute to Dwight's alcohol use. He appears to be experiencing significant occupational stress and concerns about his business, which may increase emotional strain and reinforce drinking as a coping mechanism. Additionally, although his family environment seems generally supportive, his wife has expressed concern about Dwight's drinking. While support is present, increasing tension around alcohol use may also indirectly reinforce the behavior.
White's treatment plan, there are a few different short term and long term goals that he should work towards. For some short term goals, Dwight should increase his awareness of the effects that alcohol is having on him, as well as his relationships and personal life. He should work to reduce alcohol consumption and improve his mood, and he should gain motivation to stop drinking. Some of the long term goals he should work towards are improving relationships, especially with his family, his wife, prevent relapse, and have an immense reduction in his alcohol consumption. For therapy, the first thing would be cognitive behavioral therapy, which would focus on identifying Dwight's triggers for consuming alcohol. It would focus on helping Dwight gain new interest in activities during times of wanting to drink, so he would indulge in those interests and activities instead of consuming alcohol, and help Dwight develop his coping skills. Some examples of things that would be done are stress management techniques as well as restricting his thoughts. Dwight would go through relapse prevention as well, which would focus on recognizing bad situations, situations that would make him want to drink and consume alcohol, and it would work towards reducing his cravings. Some examples of what would be done with Dwight would be to avoid drinking environments and suggest a getaway with his wife. Dwight should also go on medications, two different medications, to reduce cravings and help him to maintain sobriety. The next part of Dwight's treatment plan would be to attend support groups, the first being Alcoholics Anonymous and Smart Recovery. By attending these support groups, Dwight would feel less lonely and would understand that there are other people in his situation and it's not just him going through this. Dwight should follow up consistently. He should consistently go to therapy, whether it's cognitive behavioral therapy, relapse prevention, motivational interviewing. He should track his alcohol use. He should be tracking it on a paper on his phone. Every time he uses alcohol, it should be tracked onto that paper. And he should also follow up with a medical doctor for some physical symptoms such as blood pressure and check in on his liver. If we see Dwight follow this treatment plan, we may see a reduced use of alcohol, improved family relationships, and reduced stress, sadness, and irritation. In conclusion, Dwight's symptoms are consistent with alcohol use disorder, as his alcohol consumption has increased over time and is beginning to affect his mood, sleep, and family relationships. Although he remains functional at work, the concerns expressed by his wife and his emotional and physical symptoms indicate that alcohol is definitely becoming a significant issue and will soon start to probably affect his functionality at work. Considering the biological, psychological, and social factors involved, early intervention is definitely important with Dwight to prevent further damage. Treatment approaches such as motivational interviewing and cognitive behavioral therapy could help Dwight reduce his alcohol use and develop healthier coping strategies. There's our reference. Thank you.